All right, today we're diving into something that affects a huge number of us, hypertension. You might notice high blood pressure, right? But its impact, man, it goes way beyond just a number on a machine. It's a massive deal, so let's get right into it. So let's start with a number, 1 billion. Just let that sink in for a second. Over 8 billion people around the globe are living with hypertension. I mean, that's not just a statistic. That's an absolutely staggering figure that really paints a picture of the massive scale we're talking about here. And you know, this isn't a problem for just one part of the world. It's everywhere, a true global epidemic. And what's wild is that the numbers are climbing, especially as our lifestyles change, More sitting, more processed foods, it's all contributing to this growing crisis.
Okay, so let's get to the heart of it. What exactly is hypertension, and why do you always hear it called the silent killer? This is super important because, as you're about to see, it can be doing a ton of damage long before you even feel a thing.
So here's the simplest way to think about it. It's when the force of your blood pushing against your artery walls is just consistently too high. Seriously, picture the plumbing in your house. If the water pressure is cranked up way too high all the time, what happens? It starts to strain the pipes, right? It's the exact same idea with your body. And that 140/90 number, that's kind of the magic number where doctors say, okay, this pressure is high enough to start causing some real problem.
Now check this out. I love this chart because it shows it's not just a simple good or bad situation. You've got the green zone, normal, which is where you want to be. Then there's this yellow, elevated zone. That's like a warning light on your dashboard. Then you get into the orange and red for stage 1 and stage 2 hypertension. And that dark red at the top, hypertensive crisis, that's a get to the hospital now situation. This whole system is so crucial for figuring out the right game plan.
And this right here, this quote is everything. Most patients with hypertension are asymptomatic. That means they feel totally, completely fine. No symptoms. Nothing. And that is what makes this so incredibly dangerous. You can be walking around for years, feeling great, while inside, this high pressure is silently wreaking havoc on your body. And this slide shows you exactly what that havoc looks like. We're talking about serious damage to major organs. Your heart gets strained and overworked, which can lead to heart failure. The blood vessels in your brain get weak, which jacks up the risk of a stroke. It can trash the delicate little filters in your kidneys, and even damage the tiny vessels in your eyes. It's a full-body assault, all because of that constant, unrelenting pressure.
Okay, I know that sounds pretty scary, but here's where the story takes a turn. And it's some seriously good news. While yeah, there are some risk factors you can't do anything about, a lot of the biggest ones, they are absolutely within your control. So let's talk about what you can actually change.
So it all comes down to understanding this key difference. On one hand, you have the stuff you're stuck with, the non-modifiable risks. Things like your age, your family history, your genetics. Can't change them. But then on the other side, and this is the important part, you've got the modifiable risks. These are the things in your life where you have the power to step in and make a huge difference. And here they are, the major players. We're talking about things like obesity, eating way too much salt, smoking, drinking too much alcohol, not getting enough exercise, and yeah, even being under constant stress. Every single one of these can contribute to tightening up your blood vessels and pushing that pressure up over time. All right, so we know the risks, but just knowing isn't enough, right? The real question is, what do you do about it? Let's lay out a super clear, straightforward plan for how you can take charge of this. Honestly, it all boils down to this really simple 3-step action plan. Super easy to remember. Step 1, know your numbers. Step 2, start making some positive lifestyle changes. And step 3, talk to a pro when you need to. Okay, step 1 is the absolute foundation for everything else. You can't fix a problem if you don't know you have it, right? You've got to know your numbers. Getting your blood pressure checked and checked the right way regularly is the essential first step. It tells you where you stand and helps you see if the changes you're making are actually working. Now, step 2. This is where you get to be in the driver's seat. Making these lifestyle changes is without a doubt the cornerstone of managing high blood pressure. Just look at this. Things like cutting back on salt, losing even a little bit of weight, getting more active, quitting smoking. These aren't small things. They can have a massive, powerful impact on bringing your numbers down. And finally, step 3. Look, for a lot of us, lifestyle changes alone just aren't going to be enough to get the numbers where they need to be. And that is perfectly okay.
The good news is there are a bunch of really safe and effective medications out there. The key is just to have that conversation with your doctor. They can help figure out exactly what's right for you.
So as we start to wrap this all up, I want to leave you with the single most powerful tool we have in the fight against hypertension. And that tool is prevention. It's as simple as that. A healthy lifestyle, starting now, plus getting screened regularly, that's your absolute best line of defense. By making smart choices about what you eat, how you move, and how you manage stress, you can seriously slash your risk of ever having to deal with high blood pressure and all its nasty complications down the road. So, I'm going to leave you with one simple but really important question. It's the first step. It's the most important step. Do you know your numbers?